Mass shooting, city of Atlanta now. There's a part of this story that has gone underreported. According to the mother of the alleged mass shooter, this was over medication, mental health medication that was wrong. That's according to the mother. I will go into detail about that aspect of the story. Let's put his picture up again. You're looking at Mr. Deion Patterson. He's in custody now after allegedly killing one and injuring four. That fits the definition of mass shooting. This was a video captured, provided by the Atlanta Police Department, of Patterson. The mother reached by phone shortly after Patterson's name was released by the Atlanta PD. The mom, Miss Mignon Patterson, told the Daily Beast, and I quote, "The damn VA gave him some messed up medication, and all he wanted was an Ativan." And she hung up and did not elaborate any further. It's used to treat anxiety, all right? Anxiety. Here's another element of this tragedy not reported holistically. You actually have an individual with a bona fide mental health disorder. Now, I know many times the narrative of mental health disease is utilized in order to protect a white male going through a difficult day. But in this case, you have an individual with a chronic history of actual health, mental health issues, and he was seeking help that same day. That's why the mother brought him to the mental health professionals. There's more. The suspected gunman who opened fire in an Atlanta medical center, killing one woman and injuring four others, was apprehended on Wednesday night, according to reports. Deion Patterson, 24 years of age, allegedly opened fire in a waiting room at a Northside Hospital Medical Midtown facility at 12:08 p.m., killing a 39-year-old woman, according to the police. That is a tragedy. That's a tragedy. Everybody there is there to either A, get help or provide help. It's a hospital. Everyone there is there to get help or provide help on some level. I don't want to see people shot. I don't want to see people die. But if we don't talk about it in the full context of what we have here, no policy would change and no outcome would change if circumstances are the exact same next time. Here you have what? An intersection, a causality, if you would, of a failed healthcare system in the United States of America. And yes, mental health is provided in that. A failed mental health response system in the United States of America. And yes, that's the reason he was at the hospital in the first place, according to all of the reports, to obtain mental health treatment. There's more. Patterson was in custody, per U.S. Marshals. Police believe Patterson fled the 11th floor of the hospital in the bustling Midtown commercial and residential district and carjacked a vehicle, which was later recovered in Cobb County, north of the city. Have you yet heard a mention about him being at the hospital seeking mental health treatment? Have you heard in the narrative up front in the presentation of these articles and headlines that he was suffering a mental health crisis? No, and legitimately he actually was. This is a case where you don't have to reach. He was at the hospital seeking mental health care. You have to use a magnifying glass to find that part in the story. And most of them don't even mention the mental health element. There's more. According to CNN, I had to go to various publications in order to get this part. Apparently, this was a former Coast Guard member. So he's military. He was a service member whose family was concerned for his mental health. His family was concerned for his mental health. Reportedly arrived at an appointment with his mother Mom did the right thing. You need to get help, son. I'm going to meet you at the hospital so that you can get the help you need. Something took place during the course of that appointment, we don't know yet, that set him off, according to one of the commentators. The Atlanta police said Patterson's mother has been cooperating. Miller said something may have rattled Patterson during the appointment, whether they told him they wanted to get him into an inpatient situation that might have rattled him, whether just his presence there further agitated him. But we know we had a mother struggling with an adult child who she had concern for, that she brought him to mental health care professionals. Once again, mental health care at the forefront and center of this entire tragedy that took place in the city of Atlanta. Now, for those who refuse to acknowledge mental health care, the overexposure of the opportunity to get guns without vetting, if they push back on those narratives, on those simple policy items, I have something to remind them of. Okay? There was a poll taken by the University of Chicago. Let's put it up. University of Chicago, Harris School of Public Policy. The Associated Press, NRC, North Center for Public Affairs Research shows 71% of Americans say what? Gun laws should be stricter. 71%. Including about half of Republicans agree. The vast majority of Democrats and majority of those in gun-owning households also agree. Gun laws should be stricter. You cannot have a conversation about a mass shooting in America without talking about the underlying issues that led to it. And I know some will push back and say, well, Doc, what about illegal guns? We need to just get rid of illegal guns, illegal guns. That's the problem, Doc. Every illegal gun in America started as a legal gun in America. It only became illegal when something happened, a theft, it was involved in a crime, etc. If you believe illegal guns are the problem, you must believe that legal guns are the problem too, because you cannot get one without the other. There's more. According to the Public Policy Survey, 83% of gun owners support expanded background checks on sales of all firearms, including 72% of all NRA members, National Rifle Association members. They believe you need to have a stricter policy in this country. You need to do background checks universal. Most gun owners believe this. Most NRA members believe this, but it is still not law. It is still not policy in this country. Why? Ask yourself why. The answer is simple. Gun manufacturers, those that create the weapons, lobby against all notion of common sense as it relates to guns. There's more. The survey from Morning Consult and Politico show that 88% of respondents support universal background checks. 81% also said they support making private gun sales and sales at gun shows subject to background checks, still not law. Additionally, an overwhelming 84% said they will support preventing sales of all firearms to people who have been reported as dangerous to law enforcement by a mental health provider. Still not universal law. The survey also found that 79% strongly or somewhat supported barring gun purchases by people on the federal no-fly zone, no-fly watch list. 75%, meanwhile, strongly or somewhat support creating a national database with information about each gun sale. And 67% support banning assault-style weapons. We all agree. Do you get that? Democrats, Republicans, independents, black, white, brown, young, not so young, we all agree. Every single one of us. Universal background checks, we all agree. Red flag laws, sounds like a good idea. Mental health care provider says this individual is unstable. We may need to put them on a no gun buy list for now. Most Americans say have no problem with that. We have to balance our constitutional rights, our opportunities with those that may try to threaten us. There's a balancing here. And for the conservatives who will push back and say, well, doc, you want to take guns away? No, I don't. I don't want to take guns away. No more than I want to take your freedom of speech away. But if you utilize your speech to engage in crime, then naturally there is a penalty for that. The government can, in fact, enforce it. The idea of everybody simply having unlimited guns is ridiculous. The idea that a person who's suffering a mental health crisis or has a diagnosed active mental health disorder and is trying to get back to that place of whole, it makes sense to say, this person may not be the best individual to buy a gun right now in his life. These are common sense rules for conduct. It's not complex at all. But for those who say, well, this is about individual rights, let me remind you, it wasn't until 2008 that the Supreme Court said the right to bear arms is an individual right. They took it out of the context of the U.S. Constitution that said this was about a well-regulated militia. You see, I want you to go to Federalist paper number 46. And in 46, it clearly says the reason why they wanted a well-regulated militia. In Federalist number 46, Madison believed a federal army could be kept from forming or at least in check by state militias. A standing army would be opposed by a militia. He proffered that state militias would be able to repel the danger of a federal army. The entire reason they included that part in the Constitution was to eliminate the idea or decrease the effect of a standing federal army. You have a federal army now. Obviously, it didn't work. If we don't get this part in check and actually create policies that make sense, that, by the way, the vast majority of Americans agree with, you have to start really asking yourself who's in control. Because obviously the NRA members, if you're an NRA member, you're not in control of a damn thing. Why won't your organization lobby to fit the values that you have already said you believe in? Why keep paying them if they're not going to represent you? We actually agree. Stricter gun laws is required now. All right. Yasmin, thoughts here?
Yeah, it's good that you bring that up about how many gun-carrying Americans, Republicans and Democrats alike, both support on both sides of the aisle stricter gun laws, right? And just common sense gun laws. And I live in Texas. Guns are a big part of the culture here in Texas. And even in the most rural parts of Texas, you find Republican voters who want stronger gun laws. I'm a Democrat. I have guns in my house and I want stricter gun laws. But in this country, it's kind of two sides to the story, right? There's the mental health aspect of it, and then there's the gun aspect, right? It's the unfettered access to guns, despite the obvious and the observed consequences of that access. And it's the dwindling mental health of Americans. We are angry, we are stressed, we are scared, and we are armed. And as much as we tell ourselves that we're fine, and as much as we pretend that it's an individualistic problem that should be dealt with on an individual level, it's really not. Even if people do try to deal with it on their own, there are limited resources available to them, and they're still expected to engage in the society that made them this way while trying to deal with it. It gets to a point where taking individual responsibility isn't enough to solve societal problems. And that point happened a long time ago. It happened when we started seeing as many mass public shootings as we've been seeing for years already. It happened when individual problems became public issues on such a big scale. We can't keep expecting people to take such incredible personal responsibility without giving them the resources to do so, without funding those resources. And we can't keep saying this is what should happen when the consequences of it not happening include people actually dying and families falling apart. Whether or not it should happen, it's not happening. So we need to figure something else out.
Very well said. We will follow as the story develops.